Okay, this is my inversion table, they call it. It's made from Invert Align 2 is the name of the model, I guess. It's from STL International, invertalign.com. Anyway, you can adjust for how tall you are. It changes the pivot point, you know, when you lean backwards. And you usually wear shoes so your feet stay tight in the bottom here. I use this for when I get a pinched nerve or a backache that doesn't go away. Oop, gotta turn that around. And that's what I got now. So wear your good sturdy shoes and clamp that in tight. What else do you want to know? I got this strap down below connected so I don't go completely upside down, because for a person of my size, it's not, I don't think it's advisable to hang completely on your spine. Put all that weight on there upside down. So I basically go hang upside down for a while, a minute or two, and try to relax as much as possible. I try to keep my feet curled so they don't accidentally slip out. But I try to do it for a minute or two, and then I go back up to horizontal. And hopefully that helps relieve some nerve pinching for a while, maybe a couple days or a week. I should probably do this once a week, but I still do it just when I need it. I bought this one for $124 at Costco, and now the current model is $200, so I'm glad that I got it when I did, because it's useful. Also, for regular back tightness and stuff, I do some stretches. I made a video before, it didn't really explain, I don't think it did, how I was stretching. So what I would do is I'd lay on the floor like a doorway and put one leg straight up the doorway jamb, have the other leg flat on the floor, and I was laying flat on the floor. Hold that for at least 30 seconds, but I do it for 4 minutes, and then I stretch my legs a bit, and then I do the other leg for 4 minutes, and then I lay on my stomach, but with my front of my body up on my elbows, like I'm watching TV or something in the living room, and do that for another 4 minutes, and that usually helps loosen up my back just enough to get me through most of the day. I have to stretch my back extra when I play guitar or maybe have done some heavy lifting. I play bass guitar, and my bass guitar weighs about 10 pounds. So it's like having 10 more pounds on the front of my gut, which is not good. They sometimes recommend that you just come up to horizontal slowly, and then maybe you can go up to your feet, but some people might get dizzy. I sometimes do this, just to stretch a little. Now, if you've had a severe back injury, or you've ruptured a disc, or been diagnosed definitely with a back problem, you should probably ask your doctor if it's okay to try an inversion table. I don't know if they consider it suspect, like chiropractor or what do they call it, chiropractics. A lot of real doctors think that chiropractic is kind of a joke. I mean, I had my own experience with a chiropractor where I injured my back in a jet ski accident and spent about $700 in 2 months at a chiropractor, and then had 2 visits with a physical therapist, which showed me the stretches and stuff, and that was $60, and I got more benefit from that $60 than I did all those visits to the chiropractor. So I hope that my experience might help. I don't know. Other things you can do is daily, when you're lifting, make sure you lift properly. Lift with your legs as often as you can. Try not to bend over to lift. If you're lifting something heavy, you don't want to lift and turn. You want to move your feet with the load, and that way you can help prevent nerves from getting twisted and pinched up in the muscles, and that's where I believe that most back pain comes from, is because of tight muscles and pinched nerves. Either pinched or they could be pinched a little or pinched a lot. Maybe that's the difference between a chronic pain and occasional pain. Anyway, I'm feeling better. Pinch is definitely going down. I usually get one on the left side, left back side. So I hope that was helpful. And I'm not going to jump out of here like the old guy on the commercial, but sometimes I do this. I'll go kind of bounce down a little bit, and that'll cause some discs to pop, which is like when you're twisting or leaning back on the chair and you hear some crackling. That's helping loosen up discs, and so hope this was helpful. Bye.